Lymphoscintigraphy. What is the lymphatic system?
Lymphatic system is an important organ system in the body in relation to the immune system. Basically, these are channels and organs that deal with the immune system of the body in fighting infection or even malignancy.
What is lymphoscintigraphy?
Lymphoscintigraphy is a procedure that is used to determine if, for example, a lymph node, which is draining a tumor, if that lymph node is involved with cancer or not. Basically, it's a way to look at the extent of disease or extent of cancer.
What is a scintigram?
Scintigram is basically an image of the lymphoscintigraphy procedure. So as I mentioned, for example, we can, after injection of radiotracer around the tumor, in say in a melanoma, we take images and see the lymphatic channels. This is the scintigram that we are obtaining to see where they collect, in what lymph node they collect.
How is lymphoscintigraphy most commonly used?
Today, most commonly used with two types of cancers, melanoma and breast cancer in nuclear medicine. What we do is that we inject a small amount of radioactive radiotracer around the tumor or in some specific locations, for example, around the areola in breast cancer, and we watch and see where this radiotracer travels to through the lymphatic channel. And they collect eventually at some node, and that node is important, what we call a sentinel lymph node. That's the first draining node from that area of the tumor. And that node is used by the surgeon, for example, to see if that node is involved with cancer or not. If it is involved with cancer, the therapy is different from the time that if it is not involved with cancer. So in a way, it's useful for staging.
What other uses does lymphoscintigraphy have?
This term is also used for another procedure, and that is when, for example, a patient has what we call lymphedema. That's increased resistance to the flow of lymphatics. And these patients usually have enlarged limbs, for example, either lower limbs or higher of upper limbs. And the question is there obstruction to the lymphatic drainage from that limb? And we can use scintigram procedure or lymphoscintigraphy procedure to see if there is such an obstruction.
What does the equipment used in lymphoscintigraphy look like?
Well, the equipment that is used for lymphoscintigraphy is basically the same as that one we use for general nuclear medicine and for cardiac nuclear medicine. There's really no difference. It's basically a gamma camera system that has detectors for detecting gamma rays to form an image.
How does lymphoscintigraphy work?
Lymphoscintigraphy works based on the radiotracer that we inject. The radiotracer that we inject is basically very small particles which are labeled with radioactivity. These small particles are basically taken up by the lymphatic system. These are lymphatic cells, and that's their really function, to take up these particles, and they engulf them, they take them out, and these lymph cells travel along the lymphatic channel to their lymph nodes. And as they travel and accumulate in the lymph nodes, we see an accumulation of these particles that we initially injected around the tumor. That's how we see what the drainage pattern of the tumor is, because it's basically give us like a map of the drainage pattern, which is very important for example, for the surgeon to know where to look. When, for example, I give you an example, if a patient has breast cancer, lymphoscintigraphy is performed, and finally we find a lymph node that has accumulated the radiotracer. That's called the sentinel lymph node, the first node that accumulated this tracer. The surgeon can find that lymph node both through imaging and also what we call a gamma probe, by putting a probe over that specific lymph node where the radioactivity is the highest. and then they take that lymph node out, and they look at it, they give it to surgical pathology, and they look for metastases in that lymph node. If there is metastasis in the lymph node, then, as I mentioned, the treatment is different from when that lymph node has no evidence of metastases. So in this sense, nuclear medicine or lymphoscintigraphy is really contributing in giving a roadmap to the surgeon.
How is lymphoscintigraphy performed?
The lymphoscintigraphy is performed based upon what type, what we're really doing. So I give an example. If a patient comes in with a melanoma skin lesion, and the surgeon wants to know where does this lesion is draining to what lymph node, the patient is basically prepared by cleaning the area of where the tumor is on the skin, and then we use syringes with very small needles to inject the radio tracer, a small amount of radio tracer, maybe up to somewhere between 1 to 3 or 4 milliliter, depending upon the size of the tumor and where it is, around the tumor. This is done with the needle inserted just next to the border of the lesion and the normal skin, just underneath the skin, and all the tracer is deposited at that location, and that's the end of it at that point. Then the patient is basically taken to the camera system, and an image is obtained from that area, and also seeing dynamically where the tracer is traveling to through the lymphatic channels. And the first accumulation of tracer that we see relates to where the lymph node is. And that area is basically found by putting a mark on the skin where that lymph node, we think where that lymph node is. And then the patient is done with the study. And so some of these studies are actually done just prior to surgery. So the patient comes to the nuclear medicine lab, the lymphoscintigraphy is performed, and the patient moves on right from there to the operating room so that the surgeon can find where the node is and look at it.
What are the benefits of lymphoscintigraphy?
The benefits of lymphoscintigraphy is again very large, because we are able to prevent a lot of unnecessary procedures, surgical procedures or treatments, even by mapping out what the drainage pattern of a tumor is. For example, in the past, in breast cancer, patients underwent axillary dissection. By that means that they take a good number of nodes, the surgeon takes a good number of nodes out of the axilla on the side of the breast cancer. And that has a lot of complications. Up to 30% of patients can develop bad complications in relation to obstruction of lymphatics, pain, diminished motion of the arm. But now with lymphoscintigraphy, we are able to stage, well, quote unquote, stage the axilla and so that the surgeon can know if there is in fact tumor in the axilla or not by just looking at that sentinel lymph node. And that node among all the nodes in the axilla is identified clearly by doing a lymphoscintigraphy. So the benefit is basically to avert a lot of unnecessary axillary dissections, a lot of pain and suffering and expense.
What are the risks of lymphoscintigraphy?
Risks are extremely small, because when the radiotracer that we administer is very, very small amounts. It is radioactive material, so there is as we mentioned, there is a very small risk associated with that. But in lymphoscintigraphy, the amount of that radioactive material is extremely small, actually smaller than most other nuclear medicine techniques. So the risk is extremely small.
What will I experience during lymphoscintigraphy?
As the patient comes to the clinic, again, they are greeted and appropriate history is taken, making sure that the procedure is indicated. And then, depending upon what where the tumor is, for example, if it's a breast cancer or a melanoma, a small amount of radiotracer is delivered under the skin, for example, or around the tumor, according to the protocol. And then the patient is basically taken to the camera system, and dynamic images are obtained from the patient to see where the pattern of the drainage is. And finally, when we see a focal accumulation in some area, which tells us this could be the lymph node, the sentinel lymph node, that area on the skin is marked. And that's the end of the procedure.